Hi, my name is Alyssa Godfrey, and for the week 3 discussion, I have chosen to talk about gray platelet syndrome. Gray platelet syndrome is a rare inherited bleeding disorder that got its name because of the individual platelets having a color where they appear gray. It's a disease that is caused by a mutation in the NBAL2 gene, and it's inherited in an autosomal recessive manner. GPS results from the absence of alpha granules in platelets. So normally these granules store proteins that are then secreted during an injury to promote place of adhesiveness and wound healing to help with clotting. So symptoms, individuals with GPS generally have a low platelet count. They bruise easily. They have a tendency to bleed. And people with GPS also often have enlarged spleens, splenomegaly, and myelofibrosis, which is a type of bone marrow cancer. Prognosis and treatment. The disease unfortunately generally worsens with age because of the decreasing platelet count. So adults are at risk for fatal hemorrhage. In terms of treatment, there really isn't any besides disease management. So patients manage the disease by basically anticipating and preventing bleeding. As of 2011, there were only 60 cases reported worldwide, so it is definitely a rare disease. These are the sources that I used for my presentation. I hope you enjoyed learning about gray platelet syndrome.